tongue diagnose.
Good evening, Doc. Good evening po sa lahat. Okay, continuation po tayo sa tongue diagnosis may DC, tongue coatings, and the 8 principles. An assessment of the coating is important in order to carry out a different diagnosis according to the 8 principles. A thick coating reflects excess, and a lack of coating reflects deficiency. So una po natin mapapansin pag makapal po yung coating, this signifies excess. Kung lacking naman yung coating, this reflects naman a deficiency. For example, in the case of stomach and kidney deficiency, there may be an absence of coating, often in combination with a red tongue body. So ito po ang example sa stomach and kidney deficiency. Nawawala po yung coating dahil ito po is a yin deficiency with a red tongue body. But in spleen and kidney yang deficiency naman, magkaiba po ito. Ang una is stomach and kidney yin deficiency. However, sa spleen and kidney yang deficiency, which can lead to an accumulation of dampness, the development of this excessive disorder is manifested in a thick, white, slippery coating. So yan po yung kaibahan ng yang deficiency sa yin deficiency. Sa yin deficiency may coating, sa yang deficiency meron siyang thick, white, and slippery coating. The tongue body will typically be pale and swollen. So yan po yung kailangan natin matandaan. So ito po yung example. Ito pong isa, may coating. So this is yung yang deficiency. So, ang kabila, wala pong coating. So this is a yin deficiency example. Okay? As a general rule, a white coating reflects the presence of cold, and a yellow one presence of heat. So pag white, cold. Pag yellow, there is a presence of heat. The diagnosis of the tongue coating is of particular importance when illness are caused by externally contracted pathogenic factor. In such case, the coating will reflect their quality and the depth of penetration. So ito po yung magkapagsabi sa atin ng quality and depth of penetration ng external pathogenic factor. Thus, in the case of externally contracted wind cold, the coating is white. So coating po yung white. While in the case of externally contracted wind heat, it may be yellow. So dahil po sa presence ng heat. On the onset of banal cold caused by externally contracted wind cold, the coating is often white and thin, which is also typical of a normal tongue coating. So pag may presence of symptoms yung pasyente and yung nakita po natin sa tongue is white and thin, since may health condition po yung patient, even nakita natin na normal tongue yung white and thin, we could say that there is externally contracted being cold. Pero kung wala naman po siyang symptom na nakita natin itong white and thin coating, this indicates that there is a normal tongue coating. Okay? Once a cold has been contracted, the thickening of the tongue coating over 1 or 2 days reflect the further penetration of the pathogenic factor. At this point, the coating often begins to change its color and tends to become yellow, showing that the externally contracted wind cold has transformed into heat in the interior. So first, pag thin white, na tongue coating and nag-change to yellow. So meaning there is from external, mas pumasok po to internal yung sakit in a form of heat. This transformation is also manifested in the location of the coating on the tongue, on the body of the tongue. The tip of the tongue reflects the exterior of the body, while the middle and posterior third of the tongue reflects the interior. So, tandaan po natin sa mga nauna nating na-discuss, yung tip ng tongue, pag ito po yung naunang may changes, meaning there is an exterior pathogen na nagkakos ng problema sa pasyente. However, pag nag-shift na yung coating to the middle or posterior third, ibig sabihin mas pumasok na po yung disease condition. In the case of externally contracted vein cold, the theory is that that coating is mainly located on the anterior third of the tongue. So first, yung anterior third po yung maapektuhan ng externally contracted vein cold. But in my own clinical experience, sabi niya, it is often not visible. So, madalas daw hindi naman gaano nakikita itong anterior third na coating. It is important to realize that the coating at this stage is still quite thin. So, dahil po ito ay manipis. This tells us something about the location of the pathogenic factor, namely that the illness is still in the superficial level of the body. So, pwedeng thin or hindi natin napapansin dun sa may front third. Ibig sabihin, external pa po. And nasa superficial level of the body and has not yet penetrated into the interior. So, hindi pa po pumapasok. This thin white coating is also wet. It suggests that the dispersing function of the lung qi is impaired. So, thin white plus the presence of wet coating. So, this indicates that the lung qi is also impaired. Okay? In the case of pathogenic factor that has penetrated into a deeper level, the coating will often be located in the center of the tongue. So, mas napupunta po sa gitna ng tongue kung deeper level na po yung health condition. If the coating becomes yellow and dry, it points to the formation of inner heat that is beginning to injure the fluid. So, nasa center and nag-turn to yellow and dry, ibig sabihin, mas pumasok po yung pathogenic factor and then ini-injure na po niya yung fluid causing dryness. Thus the color, thickness, moisture, and location of coating on the tongue body all provide information about a disorder caused by an externally contracted pathogenic factor. An interesting distribution of the coating can be found in cases of acute disorder in the lesser yang, yung Xiaoyang stage of 6 stages of disease. A one-sided white, slippery, or wet coating in the right half of the tongue means that the pathogenic factor is half exterior and half interior. So ito naman, another example, one-sided lang po yung may white, slippery, or wet coating sa may right half ng tongue. Ibig sabihin, there is half exterior, half interior. If this right-sided coating is dry and yellow, it represents the retention of phlegm heat or damp heat in the gallbladder. So, kung ito po is dry and yellow, meron po yung one-sided na coating. Ito po nag-indicate na there is presence of phlegm heat or damp heat in the gallbladder. By contrast, one-sided yellow coating on the left half naman of the tongue is indicative of heat in the liver. So yung right is for the gallbladder. Ang left half naman, kung yung po yung may one-sided yellow coating, is the liver heat. Finally, yellow strips of coating on either half of the tongue, kung alin po sa magkabilaan, signify intense damp heat in the liver and gallbladder. So, presence of yellow strips kung either side po ng tongue. So, ibig sabihin, there is intense damp heat in the liver and gallbladder. So, ito po yung example. Kung titingnan po ninyong mabuti, yung right side po ng tongue, kung nakikita nyo itong cursor, there is a yellowish coloration po. These are the strips of yellow na sinasabi dito. Yellow strips of coating on either half of the tongue signify intense damp heat in the liver and gallbladder. Ito po yun. Intense heat in the liver or gallbladder. Okay? So, ito po yung example, changes on the coating due to the penetration of externally contracted pathogenic factor. So, dito po yung arrow indicates direction of the penetration from the exterior to interior. Ito po yung nasa taas. Kung mapapansin po nyo yung picture, yung number 1, yung coating is first nasa anterior third ng tongue, and with the arrow sa number 2 image, nag-move po sa gitna, ibig sabihin from exterior, pumasok na po sa interior. Same po dito sa may baba naman, yung number 1 image, may dalawang coloration po dito sa may side, and nag-move po into the center dito sa may arrow, ibig sabihin from exterior, pumasok po sa interior. Okay po? Sa different aspect of the tongue coating, excess and deficiency are reflected in the thickness of the coating. So makikita po natin yan sa difference ng thickness ng coating. However, the coating does not identify the cause. So hindi natin ma-determine kung ano po yung cause. For example, a thick coating can appear in interior as well as exterior pattern of disharmony. So sabi dito, yung pagkakaroon ng thick coating, pwedeng interior as well as exterior pattern. Among patterns caused by internal factors, so internal po like dampness, phlegm, food stagnation, interior heat, and cold are most prominent. So tandaan po natin yung mga example ng interior pattern like dampness, phlegm, food stagnation, interior heat, and cold. Ito po yung mga madalas. Among pattern caused naman by external factors, sa externally contracted, ang example naman niya is wind cold, wind heat, summer heat are the leading factors. So ito po yung madalas naman sa externally contracted. Tandaan po natin ang mga ito. To summarize, in acute cases, it is especially important to note changes in the coating. It is thin at the onset of an illness. So manipis po siya sa start ng illness and starts to thicken. It is always an indication of the further penetration of the pathogenic factor. So from thin, kumapal, ibig sabihin, the pathogenic factor penetrated to the interior. If the coating becomes thinner and lighter in color, this is a clear sign that the patient is recovering. So through the intervention of acupuncture, from thick, naging thin, and lighter in color, ibig sabihin yung intervention is effective and the patient is recovering. The pathogenic factor is now becoming weaker and the defensive protective chi is again gaining strength. So yun po yung effect. The moisture or degree of wetness of the tongue reflects the condition of the body fluid. So yung body fluid naman po yung makapagsabi ng degree ng wetness ng tongue sa tongue coating. A normal tongue should be slightly moist, which reflects the proper circulation of the fluids. A dry, wilted tongue mirrors the exhaustion of the body fluid. So pag natuyo po yung sa tongue coating, ibig sabihin na-consume or exhausted yung body fluid. Pag wet naman yung slippery coating, this may indicate an accumulation of dampness caused by a deficiency of spleen qi and yang or kidney yang. Here, the tongue body is pale and swollen. So pale po and swollen pag ganito po. Spleen qi and yang or kidney yang deficiency. And meron itong coating na white. The wet, white, and thin coating can also indicate penetration of externally contracted vein cold. So ito po yung halos magkaparehas pag externally contracted vein cold, wet, white, and thin, while yung spleen qi and yang and or kidney yang deficiency, ang pagkakaiba naman nito, meron siyang swollen. Kasi halos parehas sila na ang yang deficiency is pale and white coating, pero meron siyang swelling. Okay? If the coating appears very wet, greasy, or slightly sticky, it is described as slippery naman. This coating represents a further stage in the evolution of a wet coating and points to a more serious yang deficiency, especially if it is white, as this represents accumulation of damp cold. So from thin coating, nag-evolve po siya, nagkaroon ng wet coating. So ibig sabihin, more serious yang deficiency na makikita natin na mayroong nagka-accumulate po yung damp cold. However, this type of tongue can also indicate further penetration of pathogenic factor. Mas pumasok po. If the slippery coating appears to be of a thicker consistency and slightly greasier, it may be assumed that more dampness has accumulated. So mas kumapal, mas naging greasier, ibig sabihin more dampness has accumulated. If the coating also appears to be little sticky, the dampness is transforming into phlegm naman. If the coating is both yellow and slippery, the dampness is transforming into damp heat. So nagkaroon po ng heat, kaya yellow and slippery. This type of coating is often visible where there is disharmony between the liver and gallbladder or between the spleen and stomach. We have here case. Ang tongue description niya po is pale. Pale po yung tongue. Pale red with swollen. Kung mapapansin niyo po, mas malaki po siya sa lips. Kaya swollen type po yung tongue. Wet, white. Meron siyang thin coating. Thin, greasy, yellow coating in the posterior third. May yellow coating sa posterior third. So this is patient male with 25 years old. Sa Chinese diagnosis, slight spleen qi deficiency with accumulation of dampness. Acute externally contracted vein cold. Dahil nga ito is pale red. Meron siyang retention of damp heat in the bladder. So damp heat dahil may yellow coating sa posterior third. And yun po yung bladder area. So ang symptoms nitong patient, meron siyang generalized body aches, meron siyang headache, heavy sensation in the body dahil sa dampness, meron siyang runny nose, occasional burning sensation with urination. Sa Western diagnosis, acute cold, and yung background of disease, overwork and long-standing emotional problem. So overwork, tapos may emotional problem. Okay po? So another case, yung tongue description nito patient is a pale red and swollen with wet white thin coating. So ito po yung tongue niya. There is a depression at the root of the body. Ang root of the body ng tongue, ito po yung posterior third Sabi dito may depression, may palalim po dito na sa area na ito. This is the case of a 30 years old male. Okay? So ang Chinese diagnosis po nitong patient, meron siyang spleen Qi deficiency indicating accumulation of dampness. Yung onset of essence deficiency din. So very young pa siya, 33 years old, meron siyang essence deficiency of essence. So ang symptoms, meron siyang tiredness, lack of concentration, may heavy sensation in the head dahil may dampness, meron siyang flatulence, may inner restlessness, may weakened vision. Sa Western diagnosis, diabetes mellitus. Yung background of disease, unclear. Okay? So this is the case of a diabetic patient. Yan po yung tongue description niya. Next, we have another case of a female, 40 years old. Yung tongue description niya, pale ang tongue, swollen siya with slight teeth marks. So may mga teeth marks po dito sa may gilid. Ang tongue niya is wet, white, with a thin coating. Thin pale yellow coating in the posterior third. So may yellowish coating sa posterior dito po sa may likod ng tongue. Yung symptoms ng patient is acute stomach pain as if a stone were lying in the stomach. So parang may mabigat na bato sa may tiyan. Meron siyang nausea, depressive moods, and tiredness. Sa Western diagnosis, fibroadenoma of the left breast. Sa background to disease, may long-standing emotional problems and irregular eating habit. Yung Chinese diagnosis, meron ang patient natin ng spleen Qi deficiency with accumulation of dampness. So ito po yung madalas sa spleen Qi deficiency, makapal po or swollen ang tongue. Accumulation of damp cold, and there is retention of dampness in the lower burner. Okay po? So, thank you po for your attention.